Hey friends, Dr. Corey Babb here. Did you know that January is National Cervical Health Awareness Month? As such, it's a great time of year to talk about your annual exam, or your well woman exam, or your annual yearly, or whatever you may want to call it. A lot of ladies have questions about why this yearly exam is so important, and some may not even know really what goes into a well woman exam. As such, I thought it'd be a great time to talk about that, maybe debunk some myths, and really explain why those gynecologic exams are so important on today's Thinking Outside the Box. Let's start with the what. So what is a well woman exam? Well, by definition, a well woman exam is considered a preventative medical exam, or a type of exam that's done when you're otherwise healthy as a means of preventing future diseases or illnesses from forming. It can take many forms, but if you look at kind of the textbook definition, a well woman exam evaluates not only the physical health of the woman that's being examined, but also her emotional, social, and reproductive health as well. So breaking that down into different terms, you have basically what's called a history and a physical. So the history evaluates all the historical things that are going on with you since your last visit. So, how's your family doing? Have you had any more kids? Have you had any new medical problems, any new surgeries? Kind of things along those lines. And then the physical exam can be broken down into an either number one, gynecologic exam, and number two, non-gynecologic exam. The gynecologic exam is probably the most notorious part of the well woman exam and consists of both a breast exam and then a pelvic examination. Now there's a difference between a pelvic exam and the kind of colloquial pap smear. A pap smear is actually a very specific test that is used to evaluate the presence of what are called dysplastic cells on the cervix. And we do that by inserting a speculum, or a little device that kind of looks like a duckbill that opens up the inside of the vagina so that we can see the cervix, and then taking a little scraping or sampling of the tissue right on the outside of the cervix itself. That is then evaluated under a microscope, and the cytotechnologist that reviews it can say, yep, that looks normal, or no, it doesn't. Outside of the pap smear, there is also what's called a bimanual evaluation, and what that is using two hands, bimanual, and with one inside the vagina and one on the abdomen. And what we're doing with that is feeling your uterus, feeling your ovaries, and also feeling the bladder, pelvic sidewall, and some of the ligamentous attachments of those structures inside the pelvis itself. Now, the purpose of the bimanual exam is to see if anything feels abnormal. Do you feel a cyst on your ovary? Do you feel like is there a fibroid on the uterus? Is this portion of the vagina really painful when we touch it? So the pelvic exam and the pap smear make up the gynecologic portion of the exam, coupled with a breast evaluation. Now, when it comes to the non-gynecologic portion of the exam, that really is lumping every other organ system into that full physical evaluation. So what does your heart sound like? What do your lungs sound like? Does your thyroid feel enlarged? Do your lymph nodes feel enlarged? Things kind of along those lines. So using the history and then the physical portion of this whole annual evaluation, we can get a good idea about a woman's overall health and well-being. And also, if we see something that looks abnormal, can point us down a direction to either evaluate with future testing or laboratory testing or things along those lines. Now, as for the when, as in when do we need to see you? Well, like the name annual conveys, we would like to see you annually, or every year. Now, a portion of the gynecologic exam, the pap smear, doesn't necessarily need to be performed every year on your standard patient. Kind of newer recommendations say that for ladies aged 21 to 65, you can do a pap smear every 3 to 5 years, kind of depending on their reproductive health, sexual history, and whether or not they've had a normal pap smear in the past. Now, certain conditions such as HIV, certain cancers, things along those lines may make you need to have pap smears every year, and especially if you've had an abnormal pap smear and have had to do further evaluation for that, you should definitely consider getting that pap every year and not that 3 to 5 year for more of the screening evaluation. Breast exams should be done clinically around once a year or so, with a self-breast exam performed every month. Now, this is an area of discussion among different medical professionals. Personally, my view, as well as the view of my OBGYN colleagues, is that self-breast exams can go a long way in picking up cancers, especially at their earliest stages of development. Now, the whys. Why is this GYN evaluation important? Well, like I've said, it is a preventative exam, and as such, the focus is on preventing the development of future problems, or kind of halting the development of problems if they exist. So that's really the main reason why we do this. Obviously, I love my patients and I love to see them every year, but I don't think I've ever had a patient come in and say, oh my gosh, I'm looking so forward to seeing you. I just really had to schedule my well woman just to come in and say hi. So really the why is to take care of your health and to make sure that you are in the best health that you can be, so that the rest of the year you can enjoy things and not have to worry about things from a gynecologic standpoint. Now, a question that I'm often asked, especially by mothers of daughters, is when should my daughter come in and see you? Current recommendations are that women around the age of 14 or so should establish with a gynecologist, not for a pelvic exam or things like that, but in case they have problems during those formative adolescent and teenage years. It can also be a person that they feel comfortable talking to about things along the lines of puberty, sexuality, stuff along those lines. And then if they're having really painful periods or problems with menstruation, vaginal discharge, or breast complaints, they have a specialist that they can turn to for those issues. The flip side of that was, when do I need to stop seeing my gynecologist? Well, like I said, for pelvic exams, unless you're having an issue, you don't need to have a pap smear past the age of 65. Now, unfortunately, a lot of gynecologic cancers strike women in their older years, and so we still recommend seeing your gynecologist every year, even if you are older than that 65-year-old range. Now, in preparation for this video, I asked some of the residents and medical students that I work with, what was your first well woman exam like? Were there things that have stuck out to you in your mind? And I got some really interesting responses, so I thought I'd share some of those with you. So if you've never had a well woman exam, something to know about, or even if you've had one and you wonder what was that, maybe these could help you. First thing, what's that clicking noise? Well, speculums come in two different varieties. One is metal and one is plastic. The plastic ones, as they open, they have a little ratcheting mechanism on it. So as they open, you'll hear a click, 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 click noise. It can be kind of disconcerting, so I always tell my patients, hey, you'll hear a click here as this is kind of opening up. But if you hear that click, that's what's going on. The metal speculums, on the other hand, have kind of a little screw-like device on them. So you may hear a slight whirl or things like that as those are opening and locking in place. The big problem with the metal speculums is that they're unfortunately usually cold. So if you know that your provider uses metal speculums, you can always ask to have them warmed up before they're inserted. The second thing was, why does it hurt so much when they're putting the speculum in? Well, obviously no one likes the thought of having a metal or plastic device inserted in that type of environment, but there are a couple things that can help make the situation less unpleasant, I guess. If you can do them. So the first thing, obviously, while it's easy for me to say, is to relax as much as you can. When you clench up, or when you are anticipating that pain or that discomfort, those muscles on the outside of the vagina actually will spasm down. And that can make inserting the speculum a lot more uncomfortable, because just like if you try and push your finger through your clenched fist, it's not pleasant at all. It's the same mechanism with a speculum going through those vaginal muscles that are really tight. Now, this actually can lead to a lot of issues down the line, and some women attribute the development of a condition called vaginismus to a really uncomfortable pelvic exam. So if you have a provider that is really hurting you, don't be afraid to say, hey, that's really hurting, like stop. There are different ways we can do things. There are different sizes of speculums that we can use if we really need to evaluate things. So make sure that that's something you kind of keep in mind. Another thing is the actual attire of what you have to wear when you're getting one of these exams yourself. Some doctors' offices will have cloth gowns, some have paper gowns, some have t-shirts. Whatever it may be, if you're going to have a well woman exam, just know that you're going to have to get undressed. There's really no other way around it. You know, sometimes I've had to do breast exams with the bra still on. It's always really awkward. So just know that, you know, when you have a well woman exam, that you will have to be undressed, and that your provider should also have a chaperone in the room with them so you're not uncomfortable more than you already are in being undressed around that person. One of the medical students also said that, you know, lube is your friend when it comes to these exams. So obviously we lubricate the speculum when we're inserting it for examination, and some of that lubrication will stay on afterwards. So if you're offered like a little sanitary wipe or some Kleenex or things like that, remember that there's lubrication not only on the outside of the vagina, but also on the inside too. And as you stand up and move around, that will unfortunately liquefy and will kind of come out. So don't be afraid to use those wipes if they're offered. That lubrication is there to help make the exam less unpleasant. So I would definitely recommend using it if it's offered. The last thing that one of the medical students said was that she was surprised that even though she's scheduled with her doctor, that the exam was performed by a nurse practitioner. So there are lots of different providers that have the training to do pelvic exams. OBGYNs, such as myself, nurse midwives, nurse practitioners, family medicine doctors, internists, the list kind of goes on and on and on. So make sure that you're comfortable with whoever is going to be doing these exams. And if you're seeing a new provider, you may want to call their office and say, hey, who is actually going to be doing my exam? Is it going to be the person that I want to see, or do they have someone that works with them that typically does their non-problem visits? Well, friends, that about wraps it up for today's Thinking Outside the Box. What about you? Have you had a really good experience with a provider doing a pelvic exam, or a really bad one? What made it good? What made it bad? I'd love to hear what you have to say, so please leave a comment below. And as always, if you like what I'm saying and want to follow my channel, please follow me here, and hit that bell if you do so that you can be notified when new videos arrive. Otherwise, I'm Dr. Corey Babb, and I hope to see you next time.